Hey there. Today we're talking about overdiagnosis, a hidden epidemic that's affecting millions of people, often without them even realizing it. And to guide us through this complex issue, we're going to explore the eye-opening insights from Dr. H. Gilbert Welch's book, Overdiagnosed, Making People Sick in the Pursuit of Health. Imagine going for a routine checkup. You might think you're just getting a quick once-over. But in reality, you're opening yourself up to a barrage of potential diagnoses. Weight problems, gastrointestinal concerns, possibly even mental illnesses. Some of these diagnoses might make sense, and some might seem a bit far-fetched. But the point is, with enough tests and a keen eye, doctors can find something wrong with just about anyone. And that's where the problem of overdiagnosis begins. Overdiagnosis happens when we're diagnosed with conditions that will never cause us symptoms or threaten our lives. It's like being told your car has a problem that doesn't actually affect its performance. And while some diagnoses can be helpful, others can lead to unnecessary treatments, anxiety, and even harm. Dr. Welch provides his patients as examples, including one Mr. LeMay. He was diagnosed with severe hypertension after a visit to the emergency room. Thanks to treatment, he avoided a heart attack and likely saved his life. But then there's Mr. Bailey, an 82-year-old Vermont farmer with mild hypertension. His treatment led to a fainting spell that could have been dangerous. And Mr. Roberts, who was diagnosed with mild diabetes and ended up in a car accident because his medication lowered his blood sugar too much. The truth is, the benefits of diagnosis and treatment are closely tied to the severity of the condition. The more severe the abnormality, the more likely it is to cause problems, and the more likely treatment will help. But as we expand our definitions of what constitutes a disease, we're labeling more and more people as sick when they might be perfectly fine. Consider the case of Laura, a healthy 65-year-old woman who was screened for osteoporosis. Her T-score was slightly below average, so she was started on hormone replacement therapy. But when studies showed the therapy increased the risk of blood clots and breast cancer, she was switched to a bisphosphonate, which caused severe esophagitis. Then she developed a painful rash, and eventually she was referred to an endocrinologist who suspected she might have thyroid cancer. All this from a test that was supposed to prevent fractures. The problem of overdiagnosis isn't limited to conditions defined by numbers like blood pressure or cholesterol levels. It's also prevalent in cancer screening. Take prostate cancer, for instance. Thanks to the PSA test, we're finding more prostate cancer than ever before. But here's the catch. Many of these cancers are so slow growing that they would never have caused problems if left alone. Yet, once diagnosed, doctors often recommend aggressive treatments like surgery or radiation, which can lead to impotence, incontinence, and other serious side effects. And it's not just prostate cancer. Overdiagnosis is a problem in thyroid cancer, melanoma, and even lung cancer. In fact, a study of the Mayo Lung Study found that about half of the lung cancers detected by chest X-rays and sputum cytology represented overdiagnosis. So, why does overdiagnosis happen? There are several factors at play. First, there's the relentless expansion of medicine. We're constantly developing new tests and technologies that allow us to see more and more. But seeing more doesn't always mean finding things that matter. It often means finding abnormalities that would never have caused us harm. Then, there's the financial incentive. More diagnoses mean more patients, more treatments, and more money for the medical industrial complex, which includes pharmaceutical companies, medical device manufacturers, and healthcare providers. And let's not forget the role of true believers, those who genuinely believe that more diagnosis is always better. They argue that finding problems early saves lives, but the evidence is often lacking or inconclusive. So what can we do about overdiagnosis? First, we need to adopt a healthy skepticism about early diagnosis. We should ask ourselves, is this test really necessary? What are the potential benefits and harms? And are there alternative approaches that might be more appropriate?
We also need to recognize that symptoms matter. If you're experiencing symptoms, it's important to seek medical attention. But if you're well, you might want to think twice before undergoing screening tests, especially those that carry a risk of overdiagnosis.
Ultimately, the decision about whether to pursue early diagnosis is a personal one. It's about weighing the potential benefits against the risks and deciding what makes the most sense for you. And remember, there's no one-size-fits-all answer. Each of us has different values, different priorities, and different health concerns.
So, as you navigate the complex world of healthcare, keep in mind that more isn't always better. Sometimes, the best approach is to focus on feeling healthy and reserve medical care for when you actually need it. And if you're ever in doubt, don't hesitate to seek a second opinion or do your own research.
Thanks for tuning in. I hope it gave you some food for thought and empowered you to make more informed decisions about your health. If you enjoyed this episode, be sure to subscribe and leave us a review. And if you have any questions or topics you'd like us to cover, drop us a line. Until next time, stay curious and stay healthy.
This has been a BrightLearn video from BrightLearn.ai on the book Overdiagnosed, Making People Sick in the Pursuit of Health by Dr. H. Gilbert Welch. Visit BrightLearn.ai for more fascinating videos like this one, and naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.